Hi, I am Dr. Ravi Prakash. I am working as a consultant ophthalmologist in Vasavi Eye Care, Chandanagar, Hyderabad. Today I want to talk about computer vision syndrome. Computer vision syndrome, it is a condition which describes eye and vision related symptoms as a result of prolonged computer use. The level of discomfort increases with the amount of computer use. The common symptoms associated with this syndrome are headache, dryness of eyes, eye strain, blurring of vision, neck pain, shoulder pain, etc. The uncorrected vision problems like farsightedness, short-sightedness, astigmatism, and inadequate eye focusing and eye coordinating abilities, age-related changes like presbyopia may all contribute to the symptoms of this syndrome. Okay. Viewing a computer is different from reading a printed matter. Here the letters are not precisely or sharply defined. At the same time, the contrast of the letters to the background is reduced. In addition to this, the glare and reflection from the computer makes viewing a computer difficult. Viewing distances and angles used for computer work is often different from routinely used tasks like reading and writing. Even the minor refractive errors may significantly affect the comfort and performance of computer work. Undercorrected refractive errors may contribute major symptoms in this computer vision syndrome. People who use routinely glasses in their general work are not suitable to work in front of computer. Some people they tilt their heads at odd angles and bend towards the computer to see it clearly may cause muscle spasms, neck pain. And people who have systemic diseases like thyroid diseases, arthritis, carpal tunnel syndrome, Parkinson's syndrome may contribute symptoms to this syndrome. And some people who take systemic medications like antihistaminics, anticholinergics, diuretics, antidepressants, etc. may also cause dryness of the eyes and contribute some symptoms in this syndrome. Computer vision syndrome can be diagnosed through a comprehensive eye examination. Patient history is taken if any symptoms the patient is experiencing or any previous health problems like thyroid diseases, arthritis, etc. has to be taken, and patient is taking any systemic medicines has to be evaluated. A visual acuity is to be measured to assess the amount of vision may affect. Proper refraction has to be done to detect the refractive error and prescribe appropriate power to compensate this refractive error. A cycloplegic refraction plays an important role, especially in young people below 21 years, as most of the young computer users have refractive errors, especially latent hyperopia. A slit lamp examination has to be done to assess the tear meniscus and corneal surface. On the corneal surface, we may find superficial punctate keratitis or keratitis. A lens has to be examined to detect the formation of any cataract or like. Intraocular pressure has to be measured. Fundus examination has to be done to examine optic nerve, optic disc, vessels, macula, and peripheral retina. A Schimmer's test has to be done to assess the dryness of the eyes. Prophoresis, if available, is used as a diagnostic tool to determine the tear film impairment. Hormonal assessment like thyroid hormones, sex hormones has to be done to detect any metabolic risk factor contributing to these symptoms. X-ray of the neck is to be taken to assess the cervical vertebral curvature straightening is there, and orthopedic consultation has to be done, and if possible to take MRI of the wrist to rule out the carpal tunnel syndrome. A primary care provider should lead and coordinate the multi-system evaluation. Awareness of both visual findings and systemic findings is important in the management of this computer vision syndrome. A thorough refraction has to be done and prescribed appropriate lenses. Some people who do not use glasses in their daily routine works may benefit from the glasses prescribed specifically to view a computer. Special lens designs, lens power, lens tint and coating are to be used, and medications like artificial tears, nothing but lubricating drop, which should be preservative free, has to be used to reduce the dryness of the eyes. Of course, these symptoms may also be reduced or prevented by following some environmental adjustments like lighting, seating position, position of the monitor, position of the reference materials, etc. The monitor should be approximately 15 to 20 degrees from our eye level as measured from the center of the screen, and it should be about 20 to 28 inches away from the eyes. The lighting, the monitor should be placed that there should not be any glare, especially from the overhead lights and windows. All the windows are to be covered with drapes or blanks, and the overhead lights are replaced by desktop lamps with low wattage. If it is not possible, glare filters, screen glare filters are to be used. And regarding the seating, the chair is comfortably padded, the height of the chair is adjusted so that our foot are comfortably rest on the floor, and while typing the wrist should not touch the keyboard. And apart from this, taking a rest breaks is very important. For every 20 minutes of work, we should see a distant object around 20 feet away for 20 seconds. This is a 20-20 rule, which helps to relieve the spasm of the eye muscles, and at the same time frequent blinking will prevent from dryness of the eyes. So, patients should avoid medications which cause dryness of the eyes like antihistaminics, anticholinergics, antidepressants, etc. And proper sleep, 7 to 8 hours continuous sleep is recommended for the people who work long hours in front of computers, and regular routine exercise is also advised. Some of the complications, if these symptoms are neglected, we may see superficial punctate keratitis, neck pain, muscle spasms, etc.